Hello, and welcome to Altru Unscripted. I'm Meghan Compton, Altru's Chief Clinic Operations Officer, and I'm happy to be filling in as your host today. I'm really excited to have Dave Molmen, our interim CEO, join us today for some exciting news. Thanks for being here, Dave. First, let's start with sharing the exciting news that's in front of us.
Thanks, Meghan. We're announcing that we're resuming our new hospital project, and construction is going to start later this fall, and the planning and preparation for that is going to start right now. We're planning for the project to be completed in 2024, and we're also really excited to be announcing the development of a new ambulatory surgery center.
That's great news. Can you tell us a little bit more about why we're able to do so?
Sure, Meghan. One of the most important reasons is because of the people who are watching this program today. 2020 was a really difficult year, but thanks to a tremendous amount of work and a lot of sacrifice by a lot of people, we're where we are today. You know, this new hospital project was always an extremely important thing for the future of healthcare for our region. So it was really important. It was vital to get that project completed as soon as we could and as soon as we had the proper operational and financial support for that. And thanks to a good finish in 2020 and a strong outlook for 2021, we're there today.
Dave, can you tell us from your perspective why the hospital is so important to our community?
It's really important for the people of our region to have access to world-class care close to home. And that's what we're doing with this project, providing that for the people in our region.
Dave, can you share a little bit about how COVID will impact the final design of the new hospital project?
It was a difficult decision to pause our construction project in 2020. But as a result of that, there are new learnings that we have access to. We're fortunate, now that we've lived through the COVID crisis, to know a lot about building design that can help us in a situation like that. So we're going to be tuning in to factors like physical distancing, like hand washing, like infection control measures as we finish that design, and we'll be able to take advantage of that from the very first day of operation.
Great. Dave, what details about the new hospital project can you share with us today?
Well, there are a lot of things that we're still working on, but I can tell you a few things. One is that in that new facility, we're going to have a large deployment of cutting-edge technology, and we're going to have new surgical, procedural, and emergency room capabilities that we've never had before. The building is going to have 7 floors, and we're going to have a negative air pressure unit, which is something that we learned from our COVID experience would be helpful.
What are you most excited about?
Well, you know, I'm really excited about the fact that this new facility, in addition to being very modern and cutting edge when we open it, is a facility that's really flexible, and it will be able to adapt as the years go on to what our needs are. So when new technology comes along, this new facility can stay just as modern as it is on the day that it opens.
We also announced the addition of an ambulatory surgery center. Can you share any details about that?
This is going to be another capability that's going to be really handy for people in the community. It's going to provide a convenient and cost-effective option for people to get ambulatory surgery in cases where a hospitalization is not required. Some of the services that we're going to have included in that are eye services, orthopedic services, plastic services, and urology.
Great. Thanks, Dave, for all the detail that you shared with us today. After a really challenging year, it's such a sign of growth for both the organization and for our community. So thank you for the detail. And thank you for all of you who are watching. Please stay tuned for more updates on both our YouTube channel and social media.